know what a board of directors is supposed to do. Next slide. The learning objectives today are that participants should be able to have a stronger grasp of the key duties of the board of directors. You'll be able to select from a list a minimum of 3 board responsibilities that you can explain. And you'll be able to differentiate between the responsibilities of the board of directors and that of the chief executive officer or executive director. Next slide, please. You may be wondering which Section 330 program requirements that this webinar addresses or corresponds to, and it refers to 3 of the 19, and they're the last 3 on your site visit. These are number 17, board authority, involving roles and operations, number 18, board composition, which is about representation, and number 19, conflict of interest policy. We're going to discuss policies, and we're going to talk about bylaws and corporate approved policy. Next slide. So one of the key documents that we're using for reference for this webinar is this Governing Board Handbook. One of the very few publications that HRSA has put out regarding the health center program, and it should be noticed that this topic is governance. So the Governing Board Handbook was put out in 2001, and this is the official HRSA Bureau of Primary Healthcare Governing Board Handbook. So we're going to use it to inform this webinar today. Next slide. So the purpose of this webinar, again, is to make your job as a community or migrant health center board member easier, to make your job easier. Next slide. So on a very practical level, we want to ask, what is a board supposed to do? The answer is clear, although the role itself is not simple. For highly effective boards, knowing what is expected from the boards in terms of composition, functions, and responsibilities really is the first step to achieving highly effective boards. So there are 6 things that a board is supposed to do. The first is define and preserve the mission of the organization. The second is to make policy. The third is to safeguard the assets of the center. The fourth is to select, evaluate, and support the CEO. The fifth is monitor and evaluate performance. We have one more. To plan for the long-range future of the center. So those are the 6 roles of the board of directors. So let's go through them one by one. So in defining and preserving the mission of the organization, we're going to start with a focus on the mission statement. And the mission statement should do the following. It should explain why the health center was established and whom it serves. It should clearly depict the services that are provided. It should illustrate what makes the health center special or different, why clients should use its services rather than another provider of care. It should point to a clear direction for future center activities and priorities, and the mission statement should form the basis for future planning. It should be flexible and provide for changes in the community and in the overall healthcare marketplace. The mission statement shouldn't be a secret. You shouldn't keep it hidden from people. It should be widely distributed and visible to the center board, staff, clients, and the general community. It should be simply worded, brief, and to the point. The mission statement should be reviewed periodically. That may be once a year. It may be once every 2 years, but you should have a schedule for reviewing the mission statement. And when you do review it, you should decide whether or not it still works for your organization or whether it should be revised. And again, it is used as a guide for the overall organization. And you can see from this comic here, from this Dilbert comic, that sometimes mission statements become trivialized, just a bunch of buzzwords that are strung together. And you don't want to have that happen to your mission statement. It is, as the third item on this list says, it is supposed to be used to guide the overall organization. So here's the first poll question. I can recite the mission statement for our organization word for word verbatim. Is this true or false?
Okay, I'm going to launch the first poll question. And I will give everyone about 30 seconds to respond. So please submit your answers. Okay, a few more seconds. Looks like the majority have voted. Okay, I'm going to go ahead and close the poll question. And it looks, John, like 80% said true and 20% said false.
All right, that's terrific. The 80% have it. The mission statement is something that you should be able to repeat, and oftentimes health center employees will have it printed on the back of their business card, or it could be printed on a plaque in the waiting room of the organization at your various locations. So the 80% have it correct. All right, so remember, the mission statement is not supposed to float in space, nor are other tools like a vision statement or a corporate philosophy just supposed to be kind of random wordings. The mission statement becomes real when you tie it to goals and objectives. And as a reminder, goals are the ends of what we want to achieve, whereas objectives are the means or the way we get there. And objectives are typically quantified. So you'll be able to tell which one is the objective because there's a number associated with it. Okay, so that's the policy. That's the mission statement. We're now going to move to making policy, and I want to talk about when and why boards make policy. They do it for a couple of reasons. They want to initiate action to accomplish the health center's mission. So the policies should be directly related to the mission, guided by the mission, as a response to a changing need from within the community you serve. So for instance, if employment changes in the community that you serve, you might change, the board might change the policy on the hours of service offered at different locations to make it still convenient for patients to attend the health center under the new conditions. In addition, you may do it as a response to a directive or policy change from a funding agency such as HRSA or the Bureau of Primary Health Care. So there are a whole variety of policies, and those of you that work on the board or work with board members know that these days with the Community Health Center program, there's a big push to make sure that the policies are both robust and signed. All of them are signed by the board officer, typically, to assure that these are all board-developed policies. So there's 4 or 5 categories of policy. One set of policies are financial, another is operational. You have policies related to human resources or personnel. By requirement from HRSA, you have policies related to quality assurance and quality improvement. Then there's other categories depending on your circumstances. So one example of other categories may be a subset of financial and operational, which is related to real estate or to investments. Next slide. So here's a question that comes up a lot when we do the operational site reviews or when I do the mock reviews. My clients will ask me, John, does the board have to approve and sign off on every policy? So it's sort of a tricky question, particularly depending on how you define policy and distinguish it from procedure. Policy is board level, procedure is staff level. So it's a tricky question which has a simple answer really, and that is yes. The board does have to approve and sign off on every policy. Now I know of some health centers where they say, well, can't we just convert the majority of the policies to procedures and not have to bother the board with all that? And the answer generally is that's not a particularly good idea. It is the responsibility of the corporate board to establish policy and not to be diminished in their role, but enhanced in their role. Okay, next slide. So procedures for the board. The board should sign off on every policy in writing. All categories of policy need to be reviewed, evaluated, and approved by the entire board of directors. And this should be on a systematic, calendarized basis. And why do these policies need to be reviewed by the board? Because your community health center is a corporation and not a family-run business. And secondly, this review, evaluation, and approval by the entire board of directors is required by HRSA. So examples of important policies are PIN 2014-1, which comes from HRSA, which is on the topic of health center program governance. So it's a primary HRSA policy source. All of these PINs, the policy information notices. And this particular one supersedes any previous program guidance, inconsistent with the policy inside this document. And the purpose of the PIN is to clarify statutory and regulatory governance requirements for all lookalikes and health centers. Next slide. So another important policy is PIN 2014-2. So the first one in the year 2014 was about governance. The second one was about the sliding fee discount and related billing and collections program requirements. This should give you an idea that according to HRSA, these are two very important documents for the board and the executive leadership of the health center to pay attention to. So this particular PIN, 2014-2, applies to all health centers funded under the health center program authorized in Section 330, and it provides clarification and specification about the requirements for the health center sliding fee discount program. It includes a schedule of fees for services you are supposed to, the discount schedule of fees for services, a corresponding schedule for eligible patients that is adjusted based on the patient's ability to pay based on governing board approved policies. So you see that emphasis again on governing board approved policies. I know that a number of health centers in their objective reviews this year, the site visits that they received from HRSA, they got into trouble. They got an unmet on the sliding fee scale. So if I were to give some good advice to board members and people who work with board members at the health center at one of your upcoming meetings in the next 3 months, particularly if you have a review scheduled, I would make sure that the board becomes very, very familiar with PIN 2014-2 and make sure that your community health center policies are consistent with this PIN. Next slide. So poll question number 2. I can clearly and confidently explain the difference between policy and procedures to a new board member. Is this true or false?
Okay, I'm going to launch that question. I'll give everyone a few seconds to respond. You could please submit your answers. Okay. a few more seconds and I'll be closing the poll. Okay, I'm going to close the poll, and it looks like 91% said true and 9% said false, John.
Okay, well that's excellent because again, this is a key issue at health centers. Policy belongs to the board, procedures belong to the staff. There should be very little overlap between the two. Okay, let's move on to the third category. So we have 6 roles to cover. We're about halfway done with our time, so we're going to move right along here. The third role of the board of directors is to safeguard the assets of the health center. Most people think that this is just about the money, but it's not just about the money, although it is about the money. So this is broader than you might think, involves more than just money. So part of safeguarding the assets is the board must be in compliance, must ensure that the health center follows external rules and regulations, whether they come from HRSA or the particular state that you operate in. The board must ensure that the health center is in compliance. And in addition to that, the board must also ensure that the health center follows its own rules, such as the Articles of Incorporation, also called the Charter, and the board's bylaws. You can get dinged, you can get an unmet on the site visit if the board of directors doesn't follow its own bylaws. So compliance, safeguarding the assets of the health center involves this sort of internal compliance as well. Next slide. The board's responsibilities in the safeguarding the assets do involve money. The board is required to establish a budget. So if at your health center there's a question about who owns the budget, the answer is the budget is a plan that is the domain of the board of directors. CFO and the CEO can recommend a draft budget, but the board of directors is required to formally approve the budget each and every year for the health center. The board is also required to set the fee schedule, including determining if there is going to be a nominal fee. At some health centers, they're confused about this nominal fee issue. They believe that it is necessary or required to have a nominal fee, and the fact of the matter is HRSA does not require a community health center to have a nominal fee. You can have a 0 nominal fee or minimum payment. In terms of safeguarding the assets, the board is required to engage an outside auditor, a certified public accountant who reports to the board itself and not management. And the board should have some financial policies related to how often it's going to change the CPA service so that the CPA doesn't get too used to working with management and vice versa, and that the CPA remembers that they do report to the board and not to management. Finally, the next part of safeguarding the assets of the health center involve establishing or approving a financial reporting system from the CEO or CFO to the board. It's not like the board is expected to set up a financial reporting system itself, but receive a proposal from the management staff about financial reporting, and the board then provides guidance to the staff to determine whether or not that reporting system meets the needs of the board of directors for setting policy and making decisions at the board level. Next slide. So we have another poll question just to keep you on your toes. In order to truly understand the financial status of our health center, a board member needs to carefully study just the financial statements. Is this true or is this false?
Okay, I have launched the poll question. If you could please answer the question you see on the screen. I'll give everyone a few seconds to respond. Just a few more seconds. Okay, I'm going to go ahead and close the poll question. And John, it looks like 13% said true and 88% answered false.
Well, this is a good group because that answer, the 88% have it correct. Sometimes I think that health centers make the mistake of trying to make the board of directors into mini accountants, and that is not necessary. The reporting system is more important than an actual crawling through the financial statements on a monthly basis, because the reporting system summarizes the important information in the financial statements in such a way that the board members can monitor the performance of the health center and to make decisions, to make changes if the performance is not what you had anticipated. So we're going to move on to the fourth role of the board of directors, and that is to select, evaluate, and support the CEO. A lot of people don't realize this, but the main job of the CEO is to implement the strategic plan of the board of directors. And the reason that I know that a lot of the boards do not understand this particular responsibility is because when I look at the evaluation form that they use to evaluate the CEO, they don't include implementation of the strategic plan as part of the evaluation. And it should absolutely be included right there at the top. So the CEO has a responsibility of leading the organization in all of its activities, internal, and representing the health center to outside stakeholders. And in selecting a CEO, the board of directors wants somebody who can perform that dual internal-external role. Next slide. Selecting the CEO is a formal, serious human resources process, and do it carefully. As they say, the CEO is the only employee for the board of directors. That is, the CEO is the only employee that the board of directors directly and formally supervises. The CEO supervises all of the rest of the employees. So selecting that CEO is rather important because that CEO is the link between the board and the entire staff. Evaluating the CEO is crucial. This process should be fair, formal, and informal, and I'll explain that in a minute, frequent and professional. The board should do this collectively. That is, not just a couple of people like the board president and the officers should evaluate the CEO, but in fact the entire board should evaluate the CEO. And not only that, the board should consider getting outside stakeholders' input regarding the CEO's performance. This is often called a 360-degree evaluation. And that is, you seek input from subordinates, peers, and others in the healthcare community to give you feedback about the performance of your CEO. I mentioned that this process should be fair, formal, and informal. So the formal part refers to have a schedule, have a job description, have a form or set of forms that you use for the evaluation. But, you know, when you get to the evaluation time, there should be no surprises for the CEO or for the board. So the informal part of evaluation is the conversations that take place throughout the year, every month, between the board members and the CEO. And that's often channeled through the president, so the CEO doesn't end up feeling like they've got 13 or 15 different bosses. But informal feedback from any member of the board to the CEO is usually quite valuable. Now, I want to mention this point at the bottom. Oops, let's go back yet. We're not done with this slide. Okay, supporting the CEO is much more necessary than you might think. So I have seen boards beat up their CEOs, and it's not a pretty thing. I've also seen CEOs be abusive of board members as well, so it goes both ways. But at this point, we're talking about the board's role in supervising the CEO. The CEO of a community or migrant health center has a tremendous amount of responsibility. It's a job that has many different domains, and there's nobody that can do everything perfectly in the role of the CEO. And psychologically, the support from the board of directors, that is not to overlook any errors that the CEO is making, but rather to provide guidance and a positive attitude towards the CEO. And it's so much more important than you might think. The CEO is not nobody is able to sustain their optimism or their positive attitude without some positive feedback from the board, the people that matter to them in assessing their performance. So think twice before having sort of a, well, we'll see attitude towards your CEO. Think positive, and most likely you're going to get good results. Next slide. So here's the fourth poll question. When a health center CEO is evaluated, the board members are the only ones entitled to have input. Is this true or false?
Okay, I have launched the poll question. I will give everyone a few seconds to submit your answers. Okay, the answers are coming in. A few more seconds. Okay, I'm going to close the poll. And this time, John, it looks like 25% said true and 75% answered false.
Okay, so that's a little bit more of a split answer. Formally, officially, the board has the responsibility for evaluating the CEO. And you want to be careful about not going around the CEO and having direct communications with the employees. This is a board member or the set of board members having direct communication with the employees. But using a 360-degree evaluation tool where you get input from key subordinates, and this can be done anonymously, is often very helpful to do. And there are other key stakeholders in the environment of healthcare. For example, the local hospital administrator. The board of directors may want to ask the local hospital administrator or administrators, depending on your community. There may be more than one hospital, but you may want to ask for input from the hospital CEO regarding how good it is to work with the health center CEO and whether the health center CEO helps the community health center be a good partner with the local hospital. All right, so next we're going to number 5, and we're going along at a pretty good pace here. The fifth role of the board of directors is to monitor and evaluate health center and board performance. So sometimes this is broken up into 2 separate responsibilities. Okay, so health center and board of directors performance. So let's talk about the first one, which is to evaluate the health center. As we all know, health centers have often grown and gotten very big, and the service line has become more complicated. The business model of the community health center has changed, and we're now expected in our health centers to offer and integrate medical, dental, behavioral health, and often other services. So with this growth and diversification of services, the process of evaluation has become more complicated. And board members will naturally ask, well, what do we measure? How often do we measure it? And how do we set standards or benchmarks? Next slide. So, and the second point is that HRSA has begun a period of strict compliance in its review of health centers. The site visits, which used to be done every 5 years, are now done every 3 years. Instead of a performance improvement, a combination of compliance and performance improvement, the review is now a strict compliance review. And I do suggest to you to try to avoid getting unmets, because too many unmets will put your organization on the wrong list. And to be very specific about that, if your organization has a site visit and the reviewers walk out and you've been given quite a few unmets, your health center will be ineligible for any additional funds. So any expansion plans you had, new access point applications you were thinking of submitting, if you have too many unmets, you will not be eligible to apply for those. So if that does happen to you, you should work with your project officer to have those unmets liquidated as fast as possible so that you're in strict compliance with program requirements. I will say that this strict compliance approach is not just HRSA being mean to the health centers, but rather there were 2 reviews of oversight of by HRSA of the Community Health Center program, one by the Office of Management and Budget and one by the Inspector General of the Department of Health and Human Services. And both of them concluded that the Bureau was being too lax in its oversight of community and migrant health centers. So the Bureau has very responsibly responded to that and said, okay, we're going to make some changes. So now your review cycle is every 3 years rather than every 5. The FQHC lookalikes are no longer given a desk audit, they're given a real site visit. And instead of performance improvements, they're looking strictly at compliance, and you either are or are not in compliance. So this is probably a good time to cooperate with HRSA and get them a little bit off the hook with Congress so that the funding continues, the funding expansion continues unimpeded, and so that HRSA can report to Congress, no, we've actually done some very good oversight now, and we believe the health centers are in compliance with federal law. Keep that funding coming. Okay, so next slide. So board self-assessment is mandatory. It's not optional. It's a good idea. You should customize your assessment form for the needs of your organization. So, for example, if you do have committees and subcommittees at your particular community health center, the board self-assessment should address the performance of those committees and subcommittees. You should do the evaluation at least annually. It can be done every 2 years, probably not a great idea, because most health centers typically have an annual meeting of the board of directors, and that's a good time to discuss the board's performance for the past year and expectations for the next year. Don't let it become perfunctory or Mickey Mouse, and that is if I'm an outside consultant and I come in and I see that the board does a self-assessment and the board always gives itself A's, I'm going to wonder whether or not that self-assessment is objective. So without beating each other up, try to be objective about the performance of the board, and not only recognizing areas that you're doing well, but look for opportunities for improvement and make that board self-assessment real. Okay, next slide. So the poll question is, when the health center board of directors monitors the performance of the health center, they rely on A, our CEO to completely fill us in on how things are going, B, mainly written reports from the CEO, CMO, CFO, COO, I call those the O team, and other staff members at the health center, other sources of information to monitor the performance of the health center, or D, all of the above.
Okay, I'm launching the poll question. You could please submit your answers. More seconds. Answers are still coming in. I'll give it a few more seconds. Okay, I'm closing the poll. And it looks like we have 13% that said B, mainly written reports from the CEO, CMO, CFO, COO, and other staff members at the health center, and 88% said all of the above.
All right, well, that's great. The folks in the 13% category actually have a good point, because much of the time, the information that you'll use, the tools that you will use, are those various reports that comment about the performance of the health center. But performance monitoring of a complicated organization like a community health center has become, the evaluation process itself has become more complicated. So you rely on the input from the CEO as well as written reports and other information, including audits from your CPA, operational audits. You may have a consultant, you may hire a consultant to come by and do an efficiency analysis of your dental office, etc. So there's a variety of different ways of monitoring the performance of the health center, and the board should think of it as using many tools to assess the performance. Okay, so board self-evaluation. The board will want to look at how well does the board meet its responsibilities to meet regularly, develop and review the mission, set policies, etc. I know one community health center that got an unmet in one of the 3 governance requirements for the program expectations when they had their site review, because they did not really meet in December. They had a scheduled meeting in December, but they routinely canceled it, and when the site visit reviewer took a look at it, took a look at the minutes of the board, he talked with the CEO and said, you guys really don't meet in December, do you? And the CEO did the right thing. He told the truth and said, no, we cancel it every year. So they got dinged for that, and they now actually are going to meet in December. They're going to meet in early December, but they are going to meet December because the governance requirement, that PIN that I mentioned earlier in this presentation, 2014-1, makes a strong point that the board of directors is supposed to meet at least once a month. That is a federal requirement, no ifs, ands, or buts. So you should assess whether you're in compliance with that requirement. Reviewing the mission statement, as I said, probably good to do on an annual basis. Setting policies and signing off on them are all important to do. One way that the board can self-evaluate is to ask whether or not they keep good corporate records of its activities. The secretary of the board has a very important job in making sure that the paperwork is kept current and complete. And then finally, this third one is, how is the relationship with the CEO, your only employee? If you are at a community health center where you have terminated every single one of your CEOs for the last 20 or 25 years, and there are community health centers where that has happened, they're called Death Stars, then the board should do some significant self-assessment to try and understand why they end up having such a negative relationship with the CEO and correct that. Because after a while, there's no good applicant that's going to want to work with a board that just sequentially terminates all their CEOs. Okay, next slide. Okay, so here's additional criteria. How do board members show teamwork? How does the board renew itself? And what that means is what kind of board training goes on. Some of the best health centers that I work with have a component of board training at every single board meeting. It's just part of the routine. And they have it all scheduled out in advance. The topics are selected by the board of directors, and it provides continuous quality improvement for the board. And then, does the board set realistic goals for itself? You see this logo here, this diagram on SMART goals: specific, measurable, attainable, relevant, and time-based. So realistic goals for itself should be SMART. Next slide. So this is a fun one, planning for the long-run future of the health center. And this is one I have a particular interest in. I taught strategic planning for 6 years at the business school at Sac State, and had the privilege of being a partner in charge of a couple of hundred reviews, strategic assessments of real organizations. And frankly, I learned a whole lot through that process. And it prompts these kind of questions. Does your health center do real strategic planning or mainly visioning exercises. I put the word hallucination in there because so many times the strategic planning retreat is composed of just kind of guessing and hoping and wishing about where you're going to be in 5 years without any realistic assessment of A, the need in the community, a needs assessment, or B, an honest assessment of the capacity of the health center to actually accomplish that vision. So the next question you want to ask yourself is, does the board and the CEO working together, because typically the board and the CEO do work together to develop the strategic plan, do they engage in a systematic planning process built on a needs assessment? In a business model, this would be called market research, but that's what needs assessment is. Needs assessment is doing a systematic professional study of what services are needed to be provided by your health center to meet the healthcare needs of your community in order to improve health status, because ultimately that public health goal is the goal of the Bureau of Primary Health Care in each community health center, which is to improve the health status of your patients and the community in which they reside. So let's go on to the next slide. I guess it's still part of this slide. So the elements of a strategic planning process will be a formulation, a new formulation or review of the mission or vision statement, an organizational assessment, otherwise known as a SWOT. This is a strengths, weaknesses, opportunities, and threats. The opportunities and threats are external, and the strengths and weaknesses are internal. And when you get that honest assessment of what's there, you develop a set of strategic objectives. And this is your strategy. Next. You should develop action plans that are based on your objectives. And the action plan should be in writing. Next. You should implement the action plans. And finally, measure the results of the implemented plan. We often forget to do the measuring of the results part. Next slide. So, ask yourself this. If I can't name our health center strategy, do we really have one? I've encountered quite a few health centers that go through an elaborate strategic planning process, typically involving mainly visioning exercises. And when I ask them, okay, so what was your strategic decision? What did you decide would be your strategy? I get a blank look. So if you can't name your strategy, have you really done strategic planning? Next slide. Okay, so those are the 6 roles of the Board of Directors. I hope this was useful to you in clarifying what the duties of the board are. And I'm open to questions in the last few minutes that we have. So, Sylvia, if you could let me know if there are any questions.
Okay.
Otherwise,
I don't see any that have come through yet on the chat. So if anyone has any questions, feel free to submit them via chat at this time. And I would like to ask if you are listening to the webinar with other people in the room with you, if you could please let me know, send me a chat to let me know if there are others listening in with you.
and the reason for that is we're trying to get a census of how many people are participating in each of the webinars, because we're trying to make sure that this is useful to you and attractive to you.
I don't see any questions this time, John.
Okay, so I want to personally thank Floricel Yarley Rojas, who helped me put together these this PowerPoint and make the slides more interesting. And if you do decide after the fact that, let's take a look at the next slide. If you decide that you do have a question or two, you can email me, and because perhaps your question about governance or is about your particular board of directors, and you may not necessarily want to talk publicly about your particular circumstances. If you do have some questions that are a little more specific to your board of directors, feel free to email me at johnjtroidel@gmail.com. And I want to let you know I really enjoyed working with the staff at the National Center for Farm Worker Health in this webinar, and I look forward to seeing all of you in the future.
Okay, thank you, John. That was great information that you gave us, and I appreciate everyone for joining us today. And I will be sending out an email with an evaluation, as I mentioned earlier. If you could please complete that and submit that for us. Thank you so much.